Okay, we're recording, which means I get to say welcome, everyone. Good morning. Welcome to Friday Facts, our last Friday Facts of 2023. And we have a wonderful panel of speakers. I get to do a few things and admit people while we're talking. We have been looking forward to this for months, to be able to talk with the folks at the Chronic Disease Coalition, and it's a wonderful way to end 2023, a wonderful speakers right after our own in-person advocacy and caregiver policy discussion that we had a few days ago in person. My quick announcement is that we have one more meeting of 2023, our monthly meeting. And that is next Friday from 11 to 1. But with that, and I'm doing double duty by letting folks in because I know people are still joining us, I cannot thank Nathaniel Brown and Lauren Garetto enough for joining us on Friday Facts. Nathaniel is the Director of Advocacy. Lauren is the Director of Communications. So excited and just sending out Friday love for them for waking up. It is very early. It is 5:30 in the morning on the West Coast. And I hope that this time is worth it for you. I know it'll be worth it for us that you've gotten up so early. So welcome to both of you.
Thank you so much. Yeah, it is early, but of course worth it. Always worth it to connect with other patient advocacy groups and folks that are, fighting the same fights we are.
So we do have a history here at Friday Facts. We want to learn all about the Chronic Disease Coalition, but we're also curious about the two of you. So if you wouldn't mind just taking a quick moment just to introduce yourselves and what brought you into the patient advocacy space, or however you want to tell your story, but would love to just know a little bit more about the two of you.
Sure, I can go ahead and start, and then I'll pass it over to Lauren. So yeah, Heather, thanks for having us. Like you said, Nathaniel Brown. I'm the Director of Advocacy for the Chronic Disease Coalition. I've been doing this for almost 2.5 years. I'm no stranger to the advocacy space. Before that, I was working in healthcare policy for the state chamber where I live in Oregon, and then before that for the Portland chamber. So I am very familiar with the inner workings of legislatures, both at the state level and at the federal level. But like I said, have been doing this for 2 years and have really found it to be something I'm passionate about, something I am excited to wake up every day and do.
Wonderful. Just you're with your people. All right, Lauren, tell us a little bit about you.
Yeah, good morning. Thanks for having us. Like you said, I'm Lauren Garetto. I'm the Director of Communications for the Chronic Disease Coalition. I'm celebrating 3 years with the coalition, I believe next week, something like that. We're coming up on that, which is really, really fun and exciting. It went by so fast. I am a true comms person. I've been working in various communication roles for almost a decade. And doing work and done some work in the healthcare space, but this is really kind of my first time in patient advocacy, and it's been wonderful. It's such a rewarding role, and just so much fun to work with all these different patients. And of course, gotta give Deborah a little shout out, who's on the call here, one of our patient ambassadors. So it's been really fun, and thank you for having us.
Well, this is great. And as folks know on Friday Facts, I love to stalk our guests. I could say research, but it's more fun to say stalk. And I love in both of your bios, but Lauren, especially, talk about your passion for storytelling. And I'm excited to get into that a bit because I love that. And I think there's a lot of that happening with the North Carolina Coalition. How can we share our experiences in a way that's powerful and actionable? So with that, I turn it back to Nathaniel, who I know is in charge of giving the overview. I'm embarrassed that I didn't know more about the Chronic Disease Coalition. Tell us what the coalition, who you are, what you do.
Yeah, absolutely. And no need to be embarrassed. We're, fairly, I say new, but, we've been around since 2016, and started out small and have been growing each year. And so it was started as really just an opportunity, right? It's a true coalition. It's very a broad group of stakeholders that come together on issues that are impacting chronic disease patients no matter what disease you might have. So there's a lot of patient advocacy groups out there that are disease specific. We are not, right? We're a very big tent organization. So we have an active ambassador program that Lauren will talk a little bit about, but a lot of our function is really on the education side of things, but I handle our advocacy work. So that's basically connecting our ambassadors. I think we're 40 plus strong at this point, with their state legislators on issues that they care about. Of course, we have our own policy priorities, and I can get into those a little bit. I know, Heather, you printed those out, and just in time, we switched them up a little bit for 2024. But my work is really to advocate in state capitals and in DC for our priority legislation, and as many patients as I can bring to the table and empower to advocate for themselves and for the issues they care about, the better. So our policy work, the sort of my charge in this role is to implement our policy platform. So we view that as sort of within 3 value areas or buckets, and that's access, affordability, and representation. There's different legislative focus areas within each of those buckets. So for access, we're working to make sure patients have the access to treatment that they need when they need it, right? Making sure that the relationship between a provider and a patient is not interrupted. We work on things like step therapy reform. We work on things like Medigap expansion, which I know was an issue in North Carolina. We work on things like living donor protections, which obviously is very important in the kidney space, but is important elsewhere as well. And then in the affordability component, we work a lot around copay accumulator programs. I'm not sure how familiar folks are with those, but essentially when an insurance plan denies third-party assistance, copay coupon, it doesn't count. They'll take the money, but it doesn't count towards your deductible. We work to ban those essentially in states across the country. We work around in PBM reform, making sure that we're shining a light on some of those practices and ensuring that any rebates or savings that are negotiated between the insurance company and the pharmaceutical manufacturer are passed down to patients. So there's a number of things in the affordability bucket. And then the last one I mentioned was representation. And that's really making sure that patients have, that they're saved a seat at the table. So things like rare disease advisory councils, which are set up in a number of different states that, make recommendations to the legislature on ways to improve access to treatment or affordability for especially rare diseases. But there's also chronic kidney disease task forces where we advocate, make sure that there is a space for patients on those task forces, that their input is sought out, because the lived experience is really what's gonna drive more impactful change. So that's a little bit about what I do and sort of the policy platform of the Chronic Disease Coalition. We do it through a number of different tactics. So I do a lot of testimony and showing up to testify, but like I said, we help our ambassadors connect with their legislators, and sometimes that looks like just a quick 15-minute meeting, just to get to know you, kind of introductory meeting. Sometimes it looks like I help them craft testimony, or sometimes it looks like a letter to the editor or help with a social media post. And that's kind of where Lauren steps in wearing the comms hat. But we have a digital advocacy program, which is run through a platform called Voter Voice, but it's on our website under the Take Action menu, where we have a number of different, bills that we are trying to just generate letters and action on. A lot of them are federal, just because that makes the most sense for it to live on the website, but we do state specific calls to action as well. So eager to hear from your organization, if that's aligned with some of the work you're doing.
Yeah,
but
Completely aligned. I know I have some questions, and then I invite, I know we want to hear more about what you're doing, and then Lauren, the communications, but I invite, these are my wonderful engaged colleagues on there if they have questions. Some other sort of big picture questions about how you decide under the big tent which of the issues you promote. And with the Serious Illness Coalition, we have a lifespan approach where many of us come from the aging space, but we really work very hard to include all ages. We have partners with pediatric issues. And so are you also across the lifespan, and how do certain diseases and conditions rise to the level of your advocacy efforts?
Yeah, that's a great question. We do span, we've got ambassadors that are in college and some ambassadors that are retired. And chronic disease impacts everybody. And it's something like, half of Americans. So if it's not impacting you right now, it will. And so we definitely, like you mentioned, it's a big tent organization, and the way that we prioritize our policy issues, we go through a process every year, which we just completed for 2024, where we get in touch with our board, we get in touch with our ambassadors, we get in touch with a lot of our partner peer advocacy groups, and make sure that what we're advocating on is aligned, and that we're doing our best to amplify work that's already going on, right? Because we don't need to be out there alone, right? There's a lot of people that are doing the same thing, and we're stronger together. So we usually send out a survey. We spend a few months talking about it, making sure that the issues that we think are going to be most impactful to patients are the ones we're advocating on. And it's also an opportunity for our partners and ambassadors and board members to say, oh, you know what, I saw this issue in Kentucky, and then another one will pipe up and say, oh yeah, that's happening over here in Washington State. And so we say, okay, let's add it to the list, and we'll look at it. I think in terms of how we prioritize it during the year, because that's just an annual process, and the list is fairly long. I think there's like 10 policy priorities. But the way we prioritize it during the year is really where things are moving the quickest, and where our voice can be the most impactful. So, I'm just one person, and I handle all 50 states. I can't be in all 50 states, every single year. So we typically rely on our partners and our ambassadors to say, this is a really big conversation in my state this year, and I'd really like the help of the Chronic Disease Coalition. And so we'll go engage there. It's really truly patient-led, and we try and support our ambassadors and our advocates and their family members on the issues that they care about. And fortunately, it's always very aligned with the issues that our board and our partners are working on.
Yeah, that works. All right, I have a comment, a question, and then we're turning it over to Lauren to hear more about communications. Then we'll keep pummeling with questions. The quick comment is, Lauren, thank you so much in the chat line for calling out your website. I wanted to do that. So it's a wonderful website, really great. And so if you see it, it's the very simple chronicdiseasecoalition.org. So there's the website. And then either Nathaniel or Lauren, if you want to start, my colleague Mary Bethel asked a great question. Are you a membership organization? How do people join? And I'll add on to that. And how are you kind of funded and supported? Is that through donors or membership dues? So take that away.
Yeah, it's a mix. So primarily membership dues, and we're very fortunate to have a very engaged board of directors that come from all different industries, whether it be dialysis or whether it be rare disease, or it really spans the spectrum. But to be part of the coalition, there's no barrier to that, right? We're always looking to engage with partners like you all. We actually have a page on our website where we list out all of our partners, state specific, sometimes national. But we want the barriers to engagement to be as minimal as possible, because our partners are really the key to our success, right? We're a true coalition. And so we meet monthly. If you are interested, and this is getting into Lauren's piece, but if you're interested in engaging more, we'd be more than happy to bring you in the loop and add you to some of those monthly conversations. We're in 2024, we're starting a new partner specific I'm calling it a newsletter, but it's actually just an email from me to our partners that really lays out specific areas where they can engage and really provides a platform for us to send out issues that our partners need help on too. So we're funded through membership dues, but the coalition itself is much broader than just our board members.
Okay, that's wonderful. And I'm going to turn it over to Lauren. And I'm so glad you mentioned it's a communications comment, I guess. I really do love your website. And I did notice how you list your partners. And we're always thinking about how, and we're going to go through a website redo at some point. I really did like the way that you list them. And I kind of wrote it down, your national advocacy partners, and then your state-based advocacy partners. And then I loved your third one, how you listed your patient-led groups. And so you kind of differentiate the different kinds of partners, and then you have a nice little paragraph in really normal language. I didn't print that off about, well, how do we work with these folks? And I loved it. So Lauren, since I'm loving on your communications, both on your website and other ways, tell us about your communication efforts and how we can get involved through that.
Yeah. Thank you. Big kudos on the website. I really appreciate that. You said you're going to go through a website overhaul, and that's a lot of work. So I'm sending you a lot of good vibes for that. So yes, at the Chronic Disease Coalition, my job really is to make sure that people see the CDC and know who we are, and so that we can bring people in to really take action. So a lot of what I'm working on, right, is yes, the website, yes, our social channels, our newsletter, our blogs, our webinars, a lot of that stuff that's happening, just finding a lot of ways to get people involved and make sure that people have some way to get engaged. And so when people are talking to us about, how can I get involved in the Chronic Disease Coalition? I think there's a few different ways that we bring this to people. And it's almost a spectrum, right? So if you have just a little bit of time and you feel like you want to get sort of involved and you don't have a lot to give, which is totally okay, because we are busy people and people who are managing chronic illnesses. So you don't always have a ton of time to give. We understand that. You can follow us on social media. You can engage with those posts. You can hit share. We share a lot of our ways to get involved, or, we want you to send a letter or something, and we'll put it on our social channels, and the language is already written for you. Most of all you have to do is just sign your name and hit send, right? So you can get involved that way. All the way to our ambassador program, which is kind of our most active set of patients who are really drive what we do. As Nathaniel said, they're based all over the country, and they're our eyes and ears and our boots on the ground. And we meet with them monthly, sort of face to face, almost kind of like this meeting here, where we share with them what we're working on and, tips and ways to get involved. And then they share with us what they're working on and what we might want to be involved with. So, as Nathaniel said, that group is college students to people who are retired and everywhere in between. Just really wonderful to get insight from all those people from kind of all different walks of life. And ultimately, my job is that people understand how to tell their story so that they can be effective advocates, right? It can be a scary world to, tell your story and to make change and share those intimate details with people. And sometimes you just need a partner to kind of help you figure out, where do I start? Where do I go? And how do I do this effectively? Right. We were talking to somebody yesterday, and they just had so much story to tell and figure out, okay, what's the best place to come into all of this and really make change with that. So we wear a lot of hats here at the Chronic Disease Coalition, Nathaniel and I both. So there's no wrong person to come to if you have questions about the coalition. I will also put in the chat information about our ambassador program, so you can learn more about that there if anybody is interested. But it's a really fun group of people. I hope Deborah would agree with me. She's an advocate superstar for us. So it's so lovely to get to interact with that group.
That's great. And I didn't realize we had some local ambassadors here in North Carolina. So that's wonderful. And it really aligns nicely the Serious Illness Coalition is just finishing the year one, phase one of a Changing the Care Conversation grant funded by Community Catalyst. And there were 10 of us identified as caregiver champions. And we went through advocacy training and how to get our stories down to 25 words and 3 points, and practice doing some lobbying activities around those advocacy activities. So I think there's wonderful alignment with some of the things that we have done. And so now let's overuse the word alignment. I'm thinking about other ways to in North Carolina, and I know I am loving on your website, but one of the things I thought was really interesting in your ambassador program was you have like a great do's and don'ts on how to work with legislators, how to tell your story, do highlight the personal, like don't swear or use political comments. I don't know, it was sort of fascinating. Like you just sort of broke it down on how to share. When on your website, you also have a policy map, and it was fun to click on North Carolina, and I clicked on North Carolina, and it was like North Carolina coming soon. Like how can we amplify and promote what's happening here in North Carolina? Like how do we partner in a way to highlight some of the issues that are important here in North Carolina? Like how state specific and how national should we go? There's like 4 different questions smushed in there.
Oh yeah, no, and I can take that. You probably looked at the policy map within the past week, which is right after I wiped it clean for 2023. So we will be populating it again as bills drop, in January and sessions start. In North Carolina in 2023, and Deborah could probably speak to this too, but there was a number of different bills that we were active on. I believe one of them was a Living Donor Protection Act, which codifies protections for living donors, essentially making sure that insurance companies can't discriminate against them for making the choice to donate an organ. And then I believe there was also a Medigap expansion bill, so Medicare supplemental insurance, covering that 20% that isn't covered, which we've seen a real need for, especially in the kidney community for folks that have ESRD, but also for folks that are living with ALS. Medigap has been an issue that the ALS Association has taken on, as well as National Kidney Foundation and things like that. So they've been running legislation on Medigap, and I believe North Carolina was one of those states last year. But in terms of partnering in the future, I mean, like I said, we really rely on our partners. And so, to this group, I guess my ask would be if you see legislation that's coming up that you think the CDC could help on, or if you need a letter, somebody to submit a piece of testimony on something, if it's aligned with one of those values of access, affordability, representation, we're happy to be there. And so all you need to do is shoot me an email. And I do my best to try and keep up with legislatures and the goings on, but don't always catch everything. So if there's something that you need help on, we're here to help.
And there is, duly noted.
Yes.
And we're just, for those who on the call are involved with our legislative work, we are going to be reconvening, looking at where we are. And we had a little bit of a meeting on it on Tuesday about where we are with our legislative agendas during our advocacy meeting. So yes, you will be getting emails.
Okay, good.
I did want to ask about your work. I know it's of interest to, I see a few of us on the call here, in terms of under the increasing representation, as well as looking at issues around access. We talk a lot about health equity issues, specifically within racial equity, and how that impacts, and especially when you're looking at kidney issues and liver issues. And there's been an historical systemic issues with making sure, especially people of color, are getting the access to services. And I was just reading something a few days ago about how it can affect even organ donations if some of these numbers and norming make someone farther down on the organ list, and it becomes disparate in terms of who gets what. So that's a entree to say, is there work around health equity in your platforms?
Absolutely. And I'd say it's kind of woven throughout each, of our policy values. You mentioned transplant, and I think that's a big area. We also focus a lot on social determinants of health. That's again kind of woven throughout each of our policy areas. But I'll give an example. We had an ambassador in Illinois I believe it was earlier this year, you know, she's active, she's very active in the endometriosis space. She does her own advocacy work on healthcare issues, but she was really passionate about a bill that would have expanded housing for I believe it was veterans, or it was a housing bill in Illinois, and she asked us to get engaged on it because, you know, if you don't have housing, how are you going to manage your chronic illness, right? And so, of course, we sent a you know, letter of testimony, and I helped her advocate around that, and we did a little social campaign and tagged the sponsor, and, you know, I mean, there's that kind of thing that we can help amplify. But to answer your question, I mean, the health equity component is huge, and something that we're constantly aware of and trying to learn more about too. I could pass it over to Lauren. I know that we focused on that during one of our chronic universities this past year, you know, bringing in folks that focus exclusively on that in some of their different disease specific areas. So yes.
Lauren, I didn't know, I could keep peppering with questions. I didn't know if you wanted, I love the term chronic universities. So what's that?
I can speak to Chronic University. Yeah, we started Chronic University in 2020 when we were no longer engaging with people in person, obviously, and needed a way to continue to convene people and educate people. And so we started Chronic University, which is a monthly webinar series that we talk about a whole host of different topics that relates to the patient journey and advocacy. And it's just really a wonderful opportunity to pull in lots of different perspectives from people all over the country. So we bring in, you know, we always try to have an ambassador on to make sure we have that patient voice or some patient on there. We have partners, we have, you know, we've brought on doctors and a whole host of different people who can come in and speak to different topics. If you know me, you know I love throwing a link in the chat. So I will throw a link in the chat to Chronic University so that you guys can see that. But so we've been doing it for 3 years now, which is pretty crazy to say. Well, maybe 2 years. I think we started end of 2020. So we've been doing it for 2 years now. In 2024, we will be shifting it a little bit to not be monthly. As I'm sure all of you know, we're not glued to our computers like we were 2 to 3 years ago, right? So we want to make sure that we're in the places that provide the most value for people. So we're shifting. We'll probably host them quarterly, maybe, you know, 4 to 5 next year. And it's really going to be focused on advocacy training and how to be an effective advocate. So those 2024 topics are still being worked on right now. We have a couple ideas that we're throwing out there. But, you know, Heather, you kind of talking about some of those trainings that you did or that you took about, you know, how to get your story into 24 words or, you know, a couple bullets or whatever that may be, you know, super encouraging to hear that, because that's the kind of work that we're also doing, and the more the merrier, right? It doesn't have to just be us that's doing it.
Well, that's great. And it, again, so many things, and we use our different symposium and different, so I think we're all trying to find different ways to do share information electronically and convene people. Another question that I have, and I know we have like 2 minutes left, we talk a lot, or you've shared a lot about the work with patient individual representation. Do you connect at all under the caregiver space? And because we do a lot with caregiver engagement as well as patients. And so I'm curious about who your unit of focus is.
I can start with that. We just did a Chronic University all about caregivers, so it's been top of mind for me. So yes, definitely connect with that group. You know, I say that we're typically advocating for patients. That is our, you know, what we hone in on. But patients rely on caregivers, and patients can't do a lot of what they do without their caregivers. So we need to make sure that we're sort of advocating for them as well and shining a light on that group. Nathaniel, if I'm missing anything there, feel free to jump in.
Yeah, no, I mean, this is an area where that has been raised before in the policy space, you know, and I think it's an area of growth for us. We look to groups like yours, to kind of identify those opportunities to engage. I don't know of a lot of legislation that's out. I'm sure it's out there, but I don't know of a lot of legislation out there that specifically talks about and supports caregivers. And so would welcome ideas and thoughts on how to do that. I think we had initially talked a couple of months ago about some of that and maybe trying to connect with, I believe you've got a working group on this. So it sounds like we've got some follow-up, but yeah, to Lauren's point, it's an area of focus specifically in the education part of what we do, but in the advocacy and policy space, I think we're kind of looking.
Great. Well, and yes, this is, well, we're going to end in a minute, but there's lots of ways to connect, and especially in the caregiver space nationally, the National Strategy for Family Caregivers, the RAISE National Family Caregiving Act. I should know it a lot better. That was that Congress accepted in 2022, and a group of us were just in DC in October to try to get now Congress to implement it and to really go by. But that has passed. So there's things on the national level, things on the North Carolina level. I hate that we have to end it, but I really feel like this is what's the Casablanca. This is the beginning of a beautiful friendship. I feel like there's so much we can do together. I am thrilled to at least have this appetizer teaser meeting with you just to start a relationship. I can't, Lauren Garetto and Nathaniel Brown cannot thank you enough for coming on Friday Facts. And I'm excited for a lot more.
Yeah. Thank you for having us. Really appreciate it. This was wonderful.
Absolutely. Yeah. Talk to you soon. Thank you.